everyone, and welcome to today's deep dive. We're going to be tackling two really common health conditions,
Yeah.
anxiety disorders and type 2 diabetes.
Yeah. These are conditions that affect a lot of people.
Yeah, millions worldwide, in fact. We've got some awesome text excerpts that dive deep into these topics, and we're going to try to equip you with the knowledge to understand these conditions better.
Definitely. Understanding is key.
Absolutely. And hopefully you can even recognize some of the potential signs and understand the kinds of ways they can be managed.
That's a great goal. You know, it's interesting how these conditions, though they seem very different, often have common threads, both in their causes and how they affect people.
That is a great point. Let's start with anxiety disorders. Our sources tell us that they're incredibly prevalent worldwide. What really stood out to me is that it's not just like everyday stress.
Right.
It's so much deeper than that. What exactly makes anxiety disorders different from just regular worries?
You're right. It goes way beyond just the typical worries.
Yeah.
Think of it this way. Imagine your mind is a car. With everyday stress, you hit the brakes sometimes. But with anxiety disorder, your foot is constantly on the brake, keeping you in this state of tension and worry,
Oh, wow.
and impacting your ability to smoothly drive through life.
That's such a good analogy. And there isn't just one type of anxiety disorder, right?
No, there are a few different types.
Yeah.
Our sources outline 5 main types.
Okay.
We've got generalized anxiety disorder, GAD, where the worry feels relentless, like
That's-
it's never-ending and all-encompassing.
Yeah.
And this lasts for at least 6 months.
Wow.
People with GAD might feel like their mind is a web browser with 20 tabs open, all demanding attention at the same time,
Oh my gosh, yeah.
leaving them feeling constantly drained and struggling to focus.
Oh gosh, yeah, I can see how that would be exhausting. Then there's panic disorder, which sounds terrifying.
It can be. Those panic attacks are like surges of intense fear that can come out of nowhere. And the physical symptoms, like a racing heart, shortness of breath, and dizziness, they can be so strong that people often think they're having a heart attack.
Oh, wow.
The fear of another attack can actually lead to people avoiding doing things, or they start restricting their life to avoid triggering another panic attack.
Oh, wow. So it's like this constant state of anticipation.
Exactly.
Like dreading that next wave. That's scary. What about social anxiety disorder? I imagine that could be really isolating.
Absolutely. And it's more than just being shy.
Yeah.
Imagine you're walking into a room and feeling like everyone is staring at you and judging you, even if they're not. People with social anxiety have such intense fear in social situations that they might avoid them altogether, affecting their relationships, careers, just their overall quality of life.
Yeah, definitely. Then we have specific phobias, which seem very specific and almost irrational sometimes.
Well, they might seem irrational to someone who doesn't have them, but to the person with the phobia, the fear is very real and debilitating. So let's say you have a phobia of spiders.
Right.
Even the thought of seeing one could trigger intense anxiety, leading you to avoid basements, attics, or even outdoor activities, significantly limiting your life.
Yeah, it's incredible how much these phobias can take control. Lastly, there's obsessive-compulsive disorder, or OCD. Can you explain what's going on with that?
Think of it as a loop. Intrusive thoughts, the obsessions, followed by this urge to perform rituals or compulsions
Okay.
to neutralize those thoughts. Someone with OCD might have an obsessive fear of germs and feel like they need to wash their hands over and over, even to the point of having raw, cracked skin. The compulsions help temporarily, but the cycle keeps going, using up their time and energy.
It's like they're trapped in this pattern. So with all these different types, are there unifying features, hallmarks that just scream anxiety?
Definitely. While the specific fears or worries are different, the common thread is that feeling of excessive worry, uncontrollable worry or fear that seeps into every aspect of life.
But it's not just a mental experience, right? Our sources mention physical symptoms, too.
That's right. Anxiety shows up physically, too. Think about the fight or flight response.
Right.
It's like your body is stuck in overdrive, your heart races, muscles are tense. You might even experience stomach problems, headaches, insomnia.
Wow.
It's as if your body is always bracing for a threat, even when there isn't a real danger present.
So anxiety really takes its toll on the mind and body. What makes someone more susceptible to developing an anxiety disorder? Is it purely genetic?
It's not that simple.
Yeah.
It's like a recipe with several key ingredients.
Okay.
Genetics certainly play a role, meaning if anxiety runs in your family, you might be more predisposed.
Right.
But that doesn't mean you're destined to develop an anxiety disorder.
Gotcha.
Our environment, our experiences also shape our vulnerability.
So nature and nurture working together.
Precisely. Trauma,
Mhm.
for example, can be a big trigger. Imagine a house that's had its foundation shaken by an earthquake. It might still be standing, but it's weaker, more susceptible to future tremors. Similarly, a traumatic event can leave someone more vulnerable to developing anxiety later in life.
That's a powerful image. What other factors contribute to this recipe for anxiety?
Well, our brain chemistry plays a role.
Okay.
Neurotransmitters like serotonin and dopamine are like messengers in the brain, influencing mood and emotions. Imbalances in these chemicals can significantly contribute to anxiety disorders.
So it's like having faulty wiring in the brain's communication system.
That's a great way to put it. And even personality traits can come into play. Some people are naturally more prone to worry or more sensitive to stimulation, making them more susceptible to anxiety.
Okay. So we've got genetics, brain chemistry, experiences, and personality all kind of mixing together. But knowing all of this, what can someone actually DO if they're struggling with anxiety?
Right.
What are the options for getting help?
That's the key question, isn't it?
Yeah.
The good news is there are effective treatments available. One of the most well-established is cognitive behavioral therapy.
Okay, I've heard of CBT, but can you explain how it works?
Imagine a gardener tending to their plants. They prune away dead leaves and branches, nurture the soil, and provide the right conditions for growth. CBT is kind of like that for your mind.
Okay.
It helps identify and challenge those negative thought patterns, those weeds in your mental garden, and replace them with healthier, more balanced thoughts.
So it's about managing those anxious thoughts rather than letting them control you.
Yes.
What about medication? Does that play a role?
Medication can be a valuable tool,
Okay.
especially in the early stages of treatment. It can offer relief from overwhelming symptoms, allowing someone to participate in therapy more effectively. It's like using a crutch while you heal a broken leg.
Oh,
It
okay.
offers support during a vulnerable time.
So it's not a long-term solution.
Often it's not.
Okay.
Medications like antidepressants and anti-anxiety drugs can regulate brain chemistry, but they work best with therapy and lifestyle changes.
Okay, speaking of lifestyle changes, what role do they play in managing anxiety?
Lifestyle changes are incredibly important. It's like providing your mental garden with the right nutrients and sunlight.
Okay.
Things like regular exercise, mindfulness practices, and good sleep are those essential elements that strengthen your ability to cope with anxiety.
It's amazing how interconnected our mental and physical health are.
It really is. Even simple things like reducing caffeine, practicing relaxation techniques, and setting healthy boundaries can make a big difference. It's about creating a lifestyle that supports mental well-being.
Awesome. Now that we've explored the world of anxiety disorders, let's switch gears to type 2 diabetes.
Sounds good.
Another common condition that's often misunderstood. It all comes down to how the body uses blood sugar or glucose for energy.
Right.
And it's important to distinguish type 2 from type 1.
Right, it is. In type 1 diabetes, the body's immune system mistakenly attacks the cells in the pancreas that make insulin. Insulin's the hormone that regulates blood sugar. So people with type 1 need insulin injections to survive.
It's like their body has lost the ability to create its own insulin. So how is type 2 different?
In type 2, the body still produces insulin, but the cells become resistant to it,
Okay.
like a door that's become stiff and hard to open. The pancreas tries to make up for this by producing more insulin, but eventually it can't keep up and blood sugar levels start to rise.
Oh, wow. So it's like this gradual decline in the body's ability to manage blood sugar.
Huh.
What warning signs should people be aware of?
There are a few key symptoms to watch out for. Increased thirst and frequent urination are common early signs.
And what causes that?
When blood sugar is high, the body tries to flush out the extra sugar through your pee, which makes you more thirsty. Unexplained weight loss, or sometimes even weight gain, can also be a sign, along with constant fatigue.
So it's not just being tired after a long day, it's a much deeper exhaustion. Are there any other symptoms?
Yeah. Blurry vision can occur when high blood sugar affects those tiny blood vessels in the eyes. Also, slow-healing sores or frequent infections are red flags, as is darkened skin, usually around the neck or armpits.
Okay, that's a pretty long list.
It is.
What makes someone more susceptible to developing type 2 diabetes?
There are definitely specific risk factors, like with anxiety, it's a combination of genetic predisposition and lifestyle choices.
Okay.
Family history of diabetes increases your risk,
Great.
as does age. People over 45 are more likely to develop it.
Okay.
But we are seeing a concerning trend of type 2 diabetes in younger people, largely because of lifestyle factors.
I was just going to ask about that. Is that related to the rising obesity
I
rates?
got it.
Right.
Obesity is a major risk factor for type 2.
Okay.
Excess fat, especially around your middle, disrupts the body's ability to use insulin well. It's like having a traffic jam in your cells, preventing glucose from getting in and being used for energy.
So maintaining a healthy weight is crucial. What about exercise? Does that play a role?
Absolutely. Physical inactivity is another big contributor to insulin resistance.
Oh,
When you're active, your muscles use glucose for fuel, which helps keep your blood sugar in check. But when you're inactive, those cells become less responsive to insulin, making it harder to manage blood sugar.
it's like our bodies were designed to move. And I imagine diet is a big factor too, right?
It's arguably the most important factor.
Okay.
A diet high in refined sugars, unhealthy fats, and low in fiber is basically throwing gasoline on a fire when it comes to type 2 diabetes. Those foods cause rapid blood sugar spikes that really strain your system.
So it's not just about what you eat, but how it affects your blood sugar. Can you explain what's actually happening in the body with type 2? Why does insulin resistance develop?
It's a complex process, and scientists are still working out all the details,
Yeah.
but we know it involves a combination of genetics and those lifestyle factors we've been talking about.
Hmm.
One key player is insulin resistance.
Can you explain that a little more?
Imagine insulin as a key trying to unlock your cells to let glucose in. With insulin resistance, those locks get rusty and hard to open, making it harder for glucose to enter and be used for energy.
So the insulin is there knocking, but nobody is answering the door.
Exactly. And to make it worse, the pancreas, which makes the insulin, might struggle to keep up with the demand for more insulin.
It's like a double whammy. Cells aren't responding, and the pancreas is struggling to keep up.
Exactly. And as we talked about before, obesity throws another wrench in the system. It creates this vicious cycle.
Right. We often hear that diabetes can lead to other health problems. Can you explain how serious those complications can be?
That's a really important point. Unmanaged type 2 diabetes can have this domino effect, leading to other serious complications.
So it's not just about managing blood sugar, it's about protecting your overall health.
Exactly. One of the most worrying complications is heart disease. High blood sugar damages blood vessels over time, increasing the risk of a heart attack and stroke. Think of your blood vessels like a network of pipes. High blood sugar is like sand flowing through those pipes, gradually eroding and damaging them.
Oh, I see. So the longer the blood sugar is high, the more damage to those pipes. What other complications should we be aware of?
High blood sugar can damage the small blood vessels in the kidneys too,
Ooh.
leading to kidney disease and potentially kidney failure.
And I've heard about nerve damage as a complication of diabetes.
Yes, it's called diabetic neuropathy.
Oh,
It usually starts with numbness or tingling or pain in the hands and feet. Imagine having a constant pins and needles sensation or feeling like you're walking on pebbles,
yeah.
even on a smooth surface.
Oh my gosh. That sounds awful. Are there any other complications?
Unfortunately, yes. High blood sugar can damage the small blood vessels in the eyes, leading to diabetic retinopathy, which is a leading cause of blindness. And in really severe cases, if infections or nerve damage get too bad, amputation might be necessary.
That's a really sobering thought. It really highlights how crucial it is to manage diabetes well. So let's talk about that. What can people do to stay on top of their health and prevent these complications?
The good news is there are many things people can do to manage type 2 diabetes and live long, healthy lives.
Okay, good.
It often starts with those lifestyle changes we talked about: a balanced diet, regular exercise, and managing stress.
So similar to anxiety, it's about healthy habits forming a strong foundation.
Absolutely. But medication often comes into play as well.
Right.
There's several different types of diabetes medications, each working in a different way to control blood sugar.
Can you give us some examples of those medications and how they work?
One of the most commonly prescribed is metformin.
Okay.
It works by improving insulin sensitivity, helping those rusty locks in your cells open more easily so glucose can get in.
Oh, so it's like giving those cells a little lubrication.
That's a great way to put it.
Yeah.
Then there are sulfonylureas, which help the pancreas produce more insulin, giving it a boost. And we also have newer medications like SGLT2 inhibitors, which work by helping the kidneys remove extra glucose through your pee.
It's like an extra exit route for sugar.
Exactly.
What about insulin therapy? Is that only for type 1?
Not necessarily. Some people with type 2 might need insulin injections eventually to maintain healthy blood sugar,
Okay.
especially as the condition progresses.
So it really depends on the individual and how their body is responding.
Exactly. And regardless of what meds someone's on, regular blood sugar monitoring is essential. It's like checking your gas gauge
Oh, that makes
to make
sense.
sure you can reach your destination.
Yeah, it gives you valuable feedback.
It does.
So, we've covered a lot on both anxiety and type 2 diabetes today.
Hmm.
These are complex conditions, but it's been fascinating to learn about them and how people can manage them.
I agree. Knowledge is power. And the more we understand, the better equipped we are to take control of our health.
We've learned about different types of anxiety disorders, the symptoms, and how genetics, brain chemistry, and life experiences contribute to their development. We also explored the various treatment options,
Right.
from therapy like CBT to medications and lifestyle changes.
Exactly. And with diabetes, we discussed the difference between type 1 and type 2, the risk factors, and those potential complications if it's not managed well.
Yeah.
We also talked about the essential role of lifestyle changes, medication, and blood sugar monitoring.
This deep dive has been packed with information. But before we wrap up, I want to leave you with something to think about. We talked about the link between anxiety and physical symptoms. But what if managing stress could actually help prevent more serious health issues down the road?
That's a really interesting thought. It speaks to how interconnected our mental and physical health truly are,
Yeah,
which is something we're learning more and more about. It's something we'll definitely dive deeper into next time.
absolutely. I'm excited to keep exploring this topic further.
Me too. It's fascinating. Yeah, it really is remarkable how closely linked our mental and physical health are. Managing stress isn't just about feeling calmer, it's about potentially protecting ourselves from other health problems later on.
It makes you think. How many other conditions are influenced by our mental state? We already know that stress can weaken the immune system,
Yeah,
right?
right.
So is it possible that it plays a role in other chronic diseases too?
That's a great point. Studies have shown a link between chronic stress and all sorts of things, heart disease, digestive issues, even some cancers. It's like stress creates this domino effect throughout the body, making us more vulnerable in unexpected ways.
Wow, that really emphasizes how important it is to make mental health a priority.
Hmm.
Not just for our emotional well-being, but for our physical health too.
Exactly. It's about taking this holistic approach,
Yeah.
recognizing that every aspect of our health is connected. We can't just separate the mind from the body when we're trying to prevent and manage these conditions.
So what are some practical things people can do to manage stress and anxiety in their daily lives?
Right.
Because stress is a part of life. Deadlines, relationships, finances, we can't avoid it.
It's true. Stress is unavoidable,
Yeah.
but it's how we respond to it that makes all the difference. Think of stress like a wave. We can't stop the waves from coming, but we can learn to surf them.
I like that. So how do we become better surfers of those stress waves?
One way is to have a daily routine that includes stress-reducing activities.
Mm.
It's about building those calming practices into your day, just like you would schedule meetings.
Okay, so what are some examples of those activities? I'm always trying to add more tools to my stress toolbox.
Well, exercise is fantastic. When you're stressed, your body releases those hormones like cortisol and adrenaline.
Right.
Exercise actually burns those hormones and releases endorphins, those feel-good chemicals that boost your mood.
It's like it resets the body's stress button, and you don't have to run a marathon to get those benefits, do you?
No, definitely not.
Yeah.
Even 30 minutes of moderate exercise on most days of the week makes a big difference. A brisk walk, dancing, a bike ride, whatever gets your heart rate up.
Okay.
It's about finding things you actually enjoy and making them a part of your life.
What about calming the mind? Like meditation, that seems pretty popular these days.
Mindfulness, like meditation, is really powerful for dealing with stress and anxiety. It helps you become more aware of your thoughts and feelings without judging them,
Right.
which can help you detach from those negative thought patterns that fuel anxiety.
So it's about observing those thoughts without getting swept away by them.
Exactly. It's about creating space, allowing yourself to choose how you respond to those thoughts.
Are there different types of meditation? I've heard of guided meditation.
There's so many different techniques. Guided meditations are great when you're starting out. There are also mindful breathing exercises where you just focus on your breath, and body scan meditations where you bring awareness to different parts of your body. It's all about finding what you like and what fits into your life.
What about those moments where stress just hits you all at once?
Oh, yeah.
Are there any quick tips for those intense moments?
Deep breathing is like your secret weapon. It hits the pause button on your stress response. When you take those slow, deep breaths, It activates the parasympathetic nervous system, which calms your body down.
So it's like telling your body to chill out.
Exactly.
Yeah.
And the best part is you can do it anywhere, anytime. You don't need special equipment, just a few breaths.
That's a good reminder. Simple but powerful.
Yeah.
What about connecting with others? How does that tie into stress management?
Social support is a big deal. It helps build resilience. Spending time with loved ones or talking with a friend or therapist, those connections help buffer the negative effects of stress.
It's like having a safety net, making you feel more secure and supported.
Exactly. And sometimes just having someone listen to you without judgment can make a huge difference. It helps you feel understood and less alone.
That's so true. Let's talk more about type 2 diabetes again. I know we mentioned lifestyle changes, but what specifically does a diabetes-friendly diet look like in practice?
That's a great question. It's not about depriving yourself. It's about making healthy choices that stabilize blood sugar and keep you healthy overall.
So it's not a diet in the traditional sense,
Right.
more like a sustainable way of eating.
Exactly. The foundation is whole, unprocessed foods. Fruits, vegetables, lean protein, whole grains, healthy fats. Picture filling half of your plate with colorful fruits and veggies at every meal.
So gradual shifts toward healthier choices, not a complete overhaul.
Exactly. And you want to be mindful of portion sizes too.
Hmm?
Even healthy foods can lead to weight gain if you eat too much. It's all about finding that balance.
What about those occasional treats? Can you still enjoy them?
Absolutely. It's not about depriving yourself. It's all about moderation.
Okay.
Allow yourself those treats sometimes. Just make sure they're the exception, not the rule.
So finding that balance. What about hidden sugars? Those can be sneaky, right?
Oh yeah, they're everywhere.
Yeah.
So it's important to be a label detective.
Huh.
Really look at ingredient lists and choose products with less sugar.
Good advice. Okay, so we've got diet. What about exercise? How does that fit into managing diabetes?
Exercise is so important. It helps improve insulin sensitivity,
Okay.
meaning your cells become more responsive to insulin, allowing glucose to enter more easily.
Well,
It's like exercise helps unlock those cell doors so glucose can get in and be used.
and any movement is better than none, right?
Absolutely. Aim for 30 minutes most days. And it doesn't have to be a crazy workout at the gym. Brisk walking, swimming, dancing, gardening. Just get moving, your heart rate up.
So even small bursts of activity can make a difference.
Definitely. Don't forget strength training too. 2 to 3 times a week. Work in all those major muscle groups. You could use weights, bands, or just your body weight.
So a good mix of cardio and strength training,
You got it.
customized to what you enjoy and your fitness level.
Exactly. And it doesn't have to be a chore. Find activities you like. Make them a regular part of your life. Whether it's dancing or hiking or joining a sports team, it's about finding those things that keep you coming back for more.
Love that. Make movement a celebration, not a punishment.
Exactly.
We've talked about medication for both conditions. Can you share a little more about how they work?
Yeah,
I think it's helpful to understand the science behind them.
sure. For anxiety, medications like antidepressants and anti-anxiety drugs often work by affecting those neurotransmitters in the brain. Remember those chemical messengers?
Right, like serotonin and dopamine?
Yes. These meds can help adjust the levels of those neurotransmitters,
Mm-hmm.
which can reduce symptoms like excessive worry and fear and restlessness.
I know.
They're not a cure, but they can help manage symptoms while someone works on other coping strategies.
So it's about providing that support while working towards longer-term solutions. What about meds for diabetes? How do they lower blood sugar?
There are a bunch of different classes of diabetes meds. Each works in a different way. Metformin, for example, improves insulin sensitivity, helping your cells respond better to insulin. It also reduces glucose production in the liver. So it's working on multiple levels to keep blood sugar in check.
That's amazing. What about other medications?
Sulfonylureas stimulate the pancreas to make more insulin. That can be helpful for people whose pancreas isn't doing its job well enough on its own.
So they give the pancreas a little boost.
Exactly.
Awesome.
Then there are the newer meds, like SGLT2 inhibitors, that help your kidneys get rid of extra glucose through urine.
They're like giving your body that extra exit route for excess sugar.
Precisely.
That's so cool.
And then GLP-1 receptor agonists actually mimic a hormone that tells your pancreas to release insulin after meals, and they also slow down how fast your stomach empties.
Wow. It's fascinating how they all work in such different ways but have the same goal.
It is.
What about insulin therapy? We touched on that earlier. Is that only for people with type 1?
While it's essential for people with type 1, some with type 2 may eventually need insulin injections to maintain those healthy blood sugar levels, especially as their condition progresses.
Okay.
It really depends on the person.
Yeah, it seems like it's really individualized.
It is.
What's going on in their body and how they respond to other treatments.
Absolutely. And that's why regular monitoring is so important.
Right. We discussed blood sugar monitoring earlier. How often do people need to check their levels and what's the goal?
How often really depends on the individual and their treatment plan. Some only need to check a few times a day, others more frequently. The goal is to keep blood sugar in a range determined by their doctor.
It's like checking your GPS, making sure you're headed in the right direction.
Precisely. Regular monitoring shows how your body responds to food, exercise, meds, even stress. Then you can make adjustments.
So you're an active participant in your health.
Exactly. And these days, technology can help a lot. There are continuous glucose monitors that give you blood sugar readings in real time, apps to track data, even smart insulin pumps that adjust insulin delivery based on your needs.
Wow. Technology is changing how we manage our health.
It really is. These advancements are helping people take control of their diabetes in ways we couldn't have imagined even a few years ago.
It's amazing. We've talked a lot about the individual's role. What about healthcare professionals?
Right.
How can someone find the right support and guidance? It can be a lot to figure out on your own.
You're right. Finding a healthcare team you trust and are comfortable with is so important. It could be your primary doctor, a specialist, like an endocrinologist for diabetes,
Okay.
or a mental health pro for anxiety.
So you build this team of experts who understand your needs.
Exactly. And don't be afraid to speak up. Ask questions, share your concerns. You are your own best advocate.
So it's about being informed and taking charge of your health decisions. What about resources beyond your healthcare team? Are there other sources of support out there?
Definitely. Sport groups, online communities, educational websites, those can all provide good information. You can connect with others who understand what you're going through.
It's a good reminder that you're not alone. There's a whole community out there.
That's right. Those connections can be incredibly powerful, both for emotional support and for learning from others who faced similar things.
This deep dive has really highlighted how much control we have over our health, even when we're dealing with conditions like anxiety and diabetes.
I completely agree. It's about empowering ourselves with knowledge, making healthy choices, and seeking support.
It's about taking charge, not just being a passive bystander.
Absolutely.
And that's powerful.
It is. But before we move on, I want to emphasize something we've talked about throughout this whole conversation: the importance of prevention.
Yes. Prevention is key. We've focused on managing these conditions, but so much of what we've discussed, diet, exercise, stress management, those can actually help prevent these conditions in the first place.
Exactly. It's about shifting from disease management to disease prevention. It's about taking charge of your health destiny and creating a future where you're thriving, not just surviving.
So, what are some key takeaways for our listeners when it comes to prevention? What can we do today to build a healthier tomorrow?
It comes down to a few key things: nutrition, physical activity, and stress management. Those are the pillars of prevention, and they work together to support overall well-being.
Let's break those down. Starting with nutrition, what are some changes people can make to improve their overall health and prevent chronic conditions?
Focus on those whole, unprocessed foods we've talked about.
Okay.
Fruits, veggies, lean proteins, whole grains. Think about filling half your plate with colorful fruits and vegetables.
It's about those gradual shifts, not a complete diet overhaul.
Exactly. Be mindful of portions. Even healthy foods can add up. It's about enjoying food and nourishing your body for long-term health.
What about those sweet treats? Do they have to be completely off limits?
No, not at all. Life without a little chocolate wouldn't be very fun.
Yeah, exactly.
It's all about moderation.
Okay, good.
Have those treats every now and then. Just don't make them the everyday thing.
So it's about finding that sweet spot, literally.
Yeah.
What about those sneaky added sugars?
Yeah, those hidden sugars are everywhere. So become a label reader.
Okay,
Check those ingredient lists carefully.
gotcha. So we've covered nutrition. How much exercise do we need to stay healthy and prevent disease?
The general recommendation
Yeah.
is at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous activity every week.
Can you give some examples?
Of course. Brisk walking, swimming, cycling, dancing, anything that gets your heart rate up and your breathing a bit faster. And you can break it up. You don't have to do it all at once.
Okay, so even if you don't have a full hour, you can still get those benefits.
Exactly. And don't forget strength training. 2 or 3 sessions a week, hitting all those muscle groups. Weights, resistance bands, even just your own body weight.
So a mix of cardio and strength training tailored to you.
Precisely. And it doesn't have to be boring.
Yeah.
Find something you enjoy and make it a part of your life.
Yeah.
Like hiking, swimming, maybe join a team. It's about having fun and staying motivated.
Love that. Make movement a part of your life. What about stress management? What are some ways to keep stress under control?
We already touched on a few.
Yeah.
Mindfulness, deep breathing, getting out in nature, connecting with people.
So build up your toolbox of stress-busting techniques.
That's it. And make self-care a priority.
Yeah.
Take time for things that nourish you, mind, body, and soul.
Make yourself a priority. That's not selfish, it's essential.
Exactly. When we take care of ourselves, we're better able to take care of everything else.
Absolutely. It's about creating healthy habits that become second nature,
Yes, it is.
not a constant struggle.
Exactly. And it's never too late to start. Whether you're just starting out or want to make positive changes, every step towards prevention counts. It's like investing in your future self.
Such an important message. Every step counts. It's like investing in your future self one healthy habit at a time.
Well said.
Yeah.
And remember, prevention is not about being perfect.
Right.
It's about progress.
Yeah.
Small, sustainable changes over time.
Absolutely. Celebrate those small victories. Give yourself credit.
Exactly.
It's inspiring to realize we have so much power over our health outcomes. We can make choices to live healthier lives.
It's true. We are not passive bystanders. We are active participants in our well-being, and that is incredibly empowering.
Well, I think we've given everyone a lot to think about today, but before we wrap up, I want to leave you with one final thought.
I love a good thought to ponder. What is
Yeah.
it?
We've explored the connection between our mental and physical health, the power of prevention, and the importance of being proactive.
Right.
But what if we took it a step further? What if instead of just managing our health, we strive to optimize it?
Oh, I like that.
What if we thought of health as more than just the absence of disease, but as a state of thriving, reaching our full potential?
That's a really powerful shift in perspective. It's about realizing that health is a journey, not a destination. One of continuous growth and evolution.
Yes, it's about moving beyond just surviving to truly thriving.
And that is an exciting journey to be on.
It really is. So as we wrap up this part of our deep dive, I want you to think about what optimizing your health means to you. What can you do today to move closer to that vision?
And remember, it's not about being perfect. It's about progress.
Yeah.
Every step forward is a victory.
Absolutely. And remember, you are not alone on this journey. There are resources and support systems out there, a whole community of people rooting for you.
That's so true. So go out there, embrace the power of prevention, and start thriving.
Yes, thrive on.
And as always, thanks for joining us on the Deep Dive.
I love that idea of optimizing our health. It's not just about living longer, it's about those years being really full and vibrant.
Yeah, it's about feeling alive,
Yeah.
energetic, having purpose, like really making the most of the time we have.
It's about making those choices that nourish us. Body, mind, spirit. Choices that allow us to truly thrive.
Exactly, and it's holistic.
Right.
It recognizes how interconnected everything is, our bodies, our minds, our environment. You nourish one aspect, and it affects the whole.
And it's not like you reach this perfect state of optimized health. It's a journey, always growing, learning, discovering.
That's what makes it exciting. We're always evolving, just like our understanding of health. It's a constant process of discovery and trying new things, always getting better.
And it's important to remember we're all different.
Right.
What works for one person might not work for another.
Absolutely. There's no one-size-fits-all approach. It's about finding what works for you, what aligns with your values, what fits your life.
It's about creating that lifestyle that supports your unique needs and helps you be your best self.
Yes. It's about realizing that we can design a life that supports our well-being, a life that lets us thrive on our own terms.
This deep dive has really shown me how much power we have over our health. It's not about waiting for things to go wrong. It's about being proactive and creating a life of well-being.
Yeah. It's about shifting from that fear and reaction mindset to one of empowerment, becoming the architects of our own health.
I love that. So as we wrap up this deep dive into anxiety, type 2, prevention, and optimization, I want to leave our listeners with a call to action.
Okay, what's the action step?
It doesn't have to be huge. Maybe it's adding some extra veggies to dinner, taking a 15-minute walk, or spending 5 minutes doing deep breathing before bed.
Those small things, those seemingly insignificant choices really do add up over time.
Yes.
They can transform your health and your life.
So to everyone listening, believe in yourself, trust the journey, and embrace the power you have to shape your own health and most importantly, keep thriving.
Yes. And thank you, as always, for joining us on the deep dive.